Welcome to the Roselle Center for Healing's webinar lecture. This is an educational series that we usually do in office, but now is available in a webinar format. Feel free to use any of the contact information you have here to ask any questions or email us directly. My email is listed on this page, s.pina@rosellecare.com, and goes directly to me if you have any questions related to this or any of the other lecture topics. Today's topic is going to be on how do emotions affect your health. And we'll be going to be addressing how emotions affect us both mentally and physically, but some of the ways we learn to treat emotions and also express ourselves. We do this by looking at things from a holistic standpoint and looking at the total number of your theater masks, like these basic trestle mask set from the UK, help actors to express emotions and concentrate their ideas through movements and actions, leaving the observer to decide what is going on without words. The expression on these masks seems so basic, but one emotion can present so much information about a feeling, yet it doesn't tell you about the person behind the mask. Compared to real life, these masks actually make it easier to read the expression presented and interpret the main idea behind the feelings. It may not be said with real human emotions that are complex and rich with information, which also relies on multiple visual cues. The impact of emotional health can affect both of us, both physiologically and mentally, for both the good and the bad. Feeling excited and joyful gives us hope to take on new tasks, try new things, and make positive changes in our life. The lack of emotion, or feeling misunderstood, or feeling incapable of coping can create negative feelings and aggravate our physical health at the same time. Finding a balance between our range of emotions helps create personal well-being. The more we understand the mechanism of how emotions affect our health, the more changes we can make in our overall health and healing. During this webinar, we're going to review a number of aspects on how emotions can affect our physical health and overall well-being of not only ourselves, but the people around us. We're going to start out by reviewing the Triad of Health and how it balances the many different aspects of health and healing from biochemical, structural, and mental health and stress aspect. We're going to review how emotions affect our overall health and disease state and how both people and healthcare providers understand that they need to learn more about different types of treatment options. We're going to review how the current emotional status and situation of COVID-19 and other epidemics have had lasting impacts on physical and emotional health and how that's a predictor of how we're moving forward. We're going to be reviewing overall holistic therapies that are used to treat different types of emotional conditions and how they can be used alone or together. And finally, we're going to piece together things that we might not have thought of that we could do on our own, as well as with the help of physicians and people like at the Roselle Center for Healing. And we're going to learn how to think outside the box as far as how we think about our physical health and emotional health. So just like when we look at any kind of physical issue, we have to look at emotional issues from the Triad of Health basis. And that means that we have to balance equally the biochemistry of the body, our mental health and emotions, and our structural source. Now, a majority of people that come into the office or into any physician's office are well aware of their structural nature. They know where they feel pain. They know where something hurts. So that's not typically the first thing that people are trying to avoid. The biochemical side is usually the things that people don't want to change. So it has to deal with their food, their diet, their hydration, water intake. It has to also deal with different types of medications or supplements they may be taking and how that may be affecting their health. It also can deal with the hormones and different neurochemicals that are basically released from the brain. So when we think about emotions, we want to know different things about melatonin, dopamine, serotonin, and any medications that are related to that. And then finally, we have to look at the emotional side to see how people have responded in past situations. Are they typically a happy person or a sad person? How long have they been dealing with this situation? Or are they having complex issues? By putting together the Triad of Health, we look at everything and create a treatment plan based off of structural, biochemical, and mental, emotional, whether or not the source is an emotional issue or a physical issue. On this slide, we're going to discuss a little bit the 6 different types of emotions and other words and conditions associated with emotions. On the left side in blue, you see the 6 universal emotions of happiness, sadness, anger, fear, disgust, and surprise. And beneath it, the words frustration, jealousy, and panic can often be different combinations of these 6 different emotions. They're ones that are harder to define, even though we have an idea in our mind what each one of these emotions may feel like. On the right side, we see conditions associated with emotions, such as anxiety, depression, PTSD, PMS or PMDD, which are signs of emotions that are related to hormonal changes, such as menstrual period, postpartum depression, bipolar, and 3 more words that are associated with different types of symptoms that are seen with these emotions, such as insomnia, fatigue, both mental and physical, and brain fog. When people have a hard time expressing their emotions, sometimes it's because they don't feel like their emotion that they're feeling is essentially a part of these 6 emotions or a certain diagnosis. By helping people find their words to experience what they're actually saying, then we can kind of create a better treatment plan for them. Oftentimes when we deal with emotions, we don't have the exact words that we're looking for, and that's okay. And essentially what we want to do is work through that and kind of understand what's going on. It may mean we have to go deeper into asking somebody how their physical body's feeling. Where are they holding that stress? Where's their weak point in their body? That in itself can be better than an actual definition of what they're going through. And this can be used in a holistic standpoint because it can be ever changing and it can represent a lot of different things going on in the body. Volumes can speak a lot of words, and so if there's a lack of words and knowledge for that person, it may need more time to just develop. You want to treat them each time we treat. We know that emotions can affect how we heal and how our overall health and well-being is. Here are just a few examples of how it can affect us in a negative way. Emotional stress was more predictive of death from cancer than cardiovascular disease and from smoking. Chronic loneliness can lead to the likelihood of an early death by 14%. PTSD sufferers have a higher risk of developing digestive, respiratory, circulatory, and infectious diseases. Trauma and post-surgical wounds heal slower in patients suffering from depression. And access to care and the lack of support systems are 2 factors that inhibit treating emotional issues. There's many more issues related to getting emotional health and support for those who need it. And we see this desire and need grow more and more as more people try to come out and find those resources that they don't have available. We also see that positive emotions can create a healing response, and often this is very underrated because most of us want to think about the negative aspects of emotions and how we want to change them. But these are 3 different studies that have shown us that we do have positive effects of healing when we have emotions in the right state. The University of Arizona studies showed that expressing affectionate emotions towards your loved ones can lower your cholesterol. The University of Maryland's Medical Center found that just the anticipation of laughter began to reduce the stress hormones cortisol and adrenaline. Loma Linda University in California found that when individuals laughed at a funny movie, the levels of beta endorphins responsible for mood elevation and human growth factor or human growth hormone, which aids in sleep and contributes to cellular repair, rose by 87%. Overall, we know that this can help out our healing response, our ability to adapt to different types of stressors, and to also affect many different ways that we can move forward. When we think about emotions, we can often think about how we deal with stressors in our life as well too. When we learn about dealing with stress and the physical nature that it has on the body, we understand how emotional stress can create some of these physical reactions. So anger, fear, resentment often follow in with a physical form in the body as well too, potentially tight muscles, increased blood pressure, heavy breathing. But what's happened over the time is that our emotions have become a full-time job. So not only are we responding to different outside stressors, but we're responding to the normal everyday stress, such as our job, financial situations, and even our own health. The top 5 stressors from before used to be death from a loved one, divorce, moving, a major illness or injury, and job loss. Now, a lot of the times this doesn't come one at a time, but it may come in multiple pairs. So because of the death of a loved one, there may be moving and a job loss. But now what we're starting to see is more people get stressed out and have emotional tendencies towards burnout. 80% of Americans feel stressed about their jobs, with 40% saying that they are very or extremely stressful. And we see this in particular with certain types of careers. So when we talk with a patient about how their emotions and are dealing with how their job is undergoing, When we think about how we want to develop and change emotions, we have to think about how we react to them. And we actually learned over time how to react from a number of different ways. So right here, what I put is essentially a couple different ways that we've learned how to make reactions. And our emotions that come along with them kind of develop off of how we learned them to begin with. To put it basically, we have observed reactions, which we may have started since we were a child, and things that we just learned and picked up, things we picked up in school, what we saw people doing around us. What has our culture taught us how to react to certain situations, no matter what that situation might be? Over time, as we've understood things a little bit more, we have trained reactions. And these are the classical conditioned reactions like you hear about with Pavlov's dog, where we start to have a reaction built into us over time. We have a stimulus and then we automatically respond. Both of this type of information, they give us an idea of how to create our unique perception of how to react. So one person's experience to a stressor situation and the emotion that comes to it can be very different from another person. That unique experience is what we want to use when we're trying to help them to go through emotions, no matter what the situation is. And our unique experience also makes our treatments have to have that uniqueness as well too. When we talk about emotions, we have to deal with how these emotions can affect our stress response. Our stress kind of helps us take in that information and how do we respond back. So our different types of emotions, whether they're positive or negative, still have to deal with the psychological changes in our body. Those physiological changes also are due to different changes in the autonomic nervous system, which has two divisions, the parasympathetic and the sympathetic division. The sympathetic division, which we tend to keep in an overstressed manner, helps us basically run away from our stress, stay in still, or put up a fight. And by doing that, it creates a nervous system response that basically can open up the eyes to get as much light in. It slows down our digestive tract, and it helps speed up our heart so that basically we can have an active muscle that basically puts blood flow to the other muscles of our body. Our parasympathetic system is our rest, digest, and procreate system. So if we're actively dealing with too much stressors and we're not dealing well, we drive ourselves more into that sympathetic state. Otherwise, if our parasympathetic system can work, we're able to sleep well, our pupils will be constricted, our digestive tract can break down food, and we're able to actually hold and maintain our bladder and different stimulations. Overall, our stress response may not be what we think of it, but this is how the emotional response actually can be seen physically. And essentially, we tend to run more so in that sympathetic system. So when we try to think about how the emotions affect our body, this is where it's going down to the nervous system. So let's look at another example of how this can happen easily. Let's use this traffic intersection as an example of how our autonomic nervous system kicks in when we're doing daily physical activities. So we might drive through this intersection every single day of our lives and nothing happens. We don't react. We're normal. And at the same time, what happens is, what if there was an accident in here and so we remember that? Our body basically has that muscle memory, and our parasympathetic system, which is usually the rest system, gets pushed aside. Our sympathetic system, that fight-flight system, starts to tense up even as we start to approach it, even though the coast might be perfectly clear. We're gathering a bunch of information and what we see and hear around us. So essentially, we're taking in all of our senses to get through this one scenario. So this, for some reason, might cause more stress for other people. If we got cut off by that truck, basically we might go into a fight-right response in order to react. So anger and road rage might be our response. At other times, we might be simply able to drive through it, and our parasympathetic system still stays in control. We can have a nice, relaxed day. But these types of scenarios are daily activities that cause stress to a lot of different people. And when we sit down and have to talk about the stress that it causes them, a lot of times we have to go back to how they feel that emotionally in their body. Are they gripping the steering wheel? Are they having trouble concentrating? A lot of these stressors seem normal, but essentially over time they can keep building up. Again, you could have gone through this intersection without any issues before, but that one time you did, it's lasted an impact that might affect you emotionally on multiple levels. So our new current situation really is the unknown, and that for a lot of people can lead to a lot of emotional upheaval because we just don't know what to expect. And this everyday, ever-changing situation has been playing with our emotions and also with the information that we know and can process. We need to be able to create a safe environment for both of us physically and mentally, but we have to take into consideration there are new changes are starting to wear us down. New changes include social isolation, fear of the viral spread, quarantine, and social distancing. A lot of our social connections, whether it be local or even from a distance, are gone. Our normal everyday patterns are gone, just like going to work or school or travel in our leisure time. So when we try to learn to embrace our emotions, we have to learn to come up with ideas and work with the correct people to find solutions to make sure that we know how to move on from this unknown time into a new day. Early in 2020, Dr. Sandro Galea sat down with COVID19conversations.org to talk about mental health and the COVID-19 virus. And one of the interesting things that wasn't being discussed at the time was how mental health and emotional issues are going to play out during this pandemic. He came up with these 7 topics, and basically we're going to go through these a little bit and kind of show you what kind of things to expect. While he gives you information, and some of the current slides are taken from this lecture, I'd highly advise that you take a look at it and see what he thinks from a public health standpoint. One of the first things is he says that there's prior evidence suggesting there should be an increase in mental health and illness over the next couple of years after COVID has disappeared. And evidence has emerged that this is consistent with what we've seen in the past already. There should be an economic downturn that will be influenced by COVID, which we've already started to see with businesses closing and lockdowns happening. And ongoing stressors are a key piece of this puzzle. It's not just about the stress that we're currently in, but that's going to be placed on us for future generations as well. And mental health is inseparable of physical health, and it also has consequences that are long-term and lasting. But there are some things that we can do to help mitigate some of these problems. So in the next couple of slides, thanks to Dr. Sandro Galea, we're going to talk about some of these ideas through picture form. So let's take a look at how we might see different types of emotional events, and especially PTSD, increase after a mass trauma or global event. Dr. Galea's studies basically have done this in a number of different ways that go along with his predictions about emotional health during the COVID virus. On the left-hand side, you see a picture of Lower Manhattan, and you see a prevalence of PTSD that happened since 9/11. The spread of PTSD basically was most closest around the actual location of 9/11 in the 2 towers, and as you started to spread out, you notice less and less incidences of PTSD that continued over time. There's already been some recent evidence that has shown this to happen within the Wuhan and local surrounding areas where COVID supposedly began. Wuhan itself had a higher incidence of PTSD, which is lasting longer, while other provinces, as you reached further out, was not affected as much by this condition. The graph on the right shows us the proportional number of PTSD symptoms patients have reported after a number of days have passed after Hurricane Katrina, and how long it was until they went into remission. Those people who had less stressors in their lives and were able to cope better with their current conditions had fewer symptoms quicker, while those that had higher stressors actually took longer to get better. This goes along with what Dr. Galea was basically saying is ongoing stressors are a key piece into the picture, not just about whatever current mental health is going on or what the current mental situation is. We continue on with this by looking at a couple of other examples that he presented. We can now use this graph that shows the incidence between type 2 diabetes and post-traumatic stress symptoms as a way of kind of showing how mental health is inseparable of physical health and how the conditions are long-term and lasting. The 2 things to pay attention onto this graph is the black line at the bottom, pointed out by the green arrow. This is when there's no trauma present, and then we see a normal rise with age over time as type 2 diabetes increases. However, the pink line and pink arrow on the top shows what happens when there's an increasing number of symptoms, and 6 to 7 symptoms in fact. As that happens, not only does the rise of type 2 diabetes increase, but it's not even as gradual as it normally would with age. The more symptoms someone has of PTSD, the higher prevalence they have of basically getting type 2 diabetes. So we see that not only mental illness and mental health conditions have an issue with. In this particular graph, I want you to pay attention to what's on the lower right-hand side. And what you're seeing is actually a case of Ebola over the last outbreak. The blue and the green lines are basically showing the rise and increase of Ebola over time and how it steadily started to decrease. The bars that you see that also start to increase about the same time and decrease are actually cases of malaria. But what's interesting is the malaria cases continue afterwards and begin to rise after the Ebola virus is taken care of. So what this shows is that when so much healthcare is put into treating one particular condition or illness, there's other ones that are basically sneak through. And so we need to be careful of what overall health looks like after different types of conditions. So this might be very prevalent in the cases of COVID, where we start to see other forms of mental health and illness and emotional issues, but also we see physical issues such as hypertension, stress-related illnesses, insomnia might start to increase as well too, as it's been forgotten and they weren't respiratory symptoms that the COVID virus was paying attention to. So where do we go from here when it comes to emotional health? Well, we want to start by looking at the whole picture. It's not just about the emotions or the physical aspects of it, but how long has someone been doing this? Are they having a hard time expressing themselves? And how much frustration do they have? What are they open to trying? Because essentially we can only meet them as practitioners halfway. It's really a team effort that we're going to talk about later. But where are they? What is their healthcare goals? Finally, we have to look at the root cause as well too. Instead of just looking at their diagnosis codes that another physician has given them, what seems to be the real issue they're having problems with? Is there a trigger event? Is there something that happened in their lives, or were they exposed to something that essentially has created this issue? That might also mean investigating where they lived before, what types of diet they have, or what kind of supplements they're taking or medications. It also means finding out what their regular daily schedule is like, especially during these times, how that regular schedule has changed. We then want to create a treatment plan that's based off of what we've talked with them and what the person's plan is. The idea of a plan of just saying, I want to be happy isn't specific enough. So we want to try to make it as a specific plan and put time and deadlines on there as well too. This is just like creating a business plan, but it's your health plan. And by creating a plan, it's a clear-cut path to what we want to do with that person as far as their needs go. And that plan may need to change and be modified as necessary. When it comes to healthcare, no one fits in one particular mold, so that might mean bringing in multiple practitioners and treatment styles. So that's where a team approach becomes really important. Team approaches are great because they can take in the old information that someone had, say lab diagnostics, medications that have been prescribed, different types of therapies or meditations that has been done that seems to work for that person, and even the things that didn't work for that person, and apply it to new resources. What new information do we have about this person? What do we need to get and gather? And also, what types of practitioners are going to work best for this particular person and their needs? And finally, I tell my patients, there's always the 80-20 rule. And basically that means if we can help you 80% of the time, we leave out 20% to be the human factor. And that may have a lot of times to do with dietary changes, because 80% of the time if we eat well, 20% of the time we take into factors that we don't have, like travel and being on the run, and occasionally that the great foods that we want to eat that we shouldn't be eating. But essentially the same thing goes for treatment too. If you're putting in the effort 80% of the time, 20% of the time we have to allow some creativity for you to be you. So we're going to go through some of the holistic resources that help out with different types of emotional issues. And that way you can kind of understand what we do at the office, but then also what our patients might have a chance to experience. When dealing with mental emotional issues and coming up with different types of treatment plans in order to serve that one individual that comes in with this issue, you have to look at things outside the box. And so when you look at holistic measurements, you're trying to look at the body as a whole. And this list of different types of therapies basically does that. You're not just one part of your body, you're a whole body. You're not an arm or a leg, you're the arm and the leg and the person that's having anxiety and depression. So sometimes we use multiple different combinations of these different types of therapies in order to best suit the person. We have to think a little bit differently, think outside the box. Mind-body medicine is one of the ones that's typically used, and this might involve some of the traditional types of therapies such as cognitive behavioral therapy. Chiropractic and craniosacral therapy kind of helps to open up the nervous system to allow nerve functions to and organ systems to function properly. Acupuncture, botanical medicine, massage, exercise, and different types of movement therapies, even nutrition and homeopathic care can also be used together so that we create a better picture of what's going on inside the body and how it interacts with the outside environment. Overall, each one of these therapies may not be necessarily suited for every single person who comes in, but there are key individuals that will respond better to one practitioner or to one treatment. So we keep this in mind and create an individual treatment for every single patient that's coming in. One of the key and interesting things with dealing with emotional issues too is this idea of neuroplasticity. Now, if we talked about neuroplasticity before, the ability for the brain to keep changing itself, to learn new things, to change its emotions, to find different connections with the world. And basically, we've learned about this more so in the context of different types of brain injuries, brain helps, rethinking patterns. But this can also be applied to physical and emotional conditions. And sometimes, especially for the emotional conditions, it can be something that's clearly quick to learn, or it can be something that has to take more long-term training. And we see this when we see something like a biofeedback response, even acupuncture, homeopathy that works on an energetic level can start to change neuroplasticity as well. The nutrients that we supply the brain, such as omega fatty acids, making sure we have the right cofactors such as B vitamins, and making sure that the brain's not toxic by making sure it's getting good food and good sources of hydration, are all things that kind of help the brain basically heal itself and create these new synapses. More and more information about neuroplasticity is going to come out over the years, and so what's amazing is we don't even have to wait for certain stressors to respond. There's been research studies that have shown that trying to train the brain to become less stressed and training individuals such as military students to become less stressed before they go into battle or go into the front lines has been able to change the neuroplasticity of their brains so they don't respond to stress the same. So if they can change, so can't we. So every time we're working on brain function, we're actually working on our own endocrine system, adrenal system, and also our nervous system at the same time. In traditional Chinese medicine, which is a holistic system of medicine that includes the most popular aspect of acupuncture, but also includes herbal medicine, dietary medicine, exercise such as Qigong, Tai Chi, Tuina massage, and diet and lifestyle recognitions, also includes emotions as one of the many factors that influences health and well-being. Along with hot and cold conditions, different pathological conditions, poor diet, and excessive lifestyle, emotions play an important role in diagnosis and in treating a patient. The 5 elements are each assigned an emotion to which an organ system expresses too little or too little of these emotions can lead to an unbalanced health. For example, when we look at this slide here, the organ of the liver represents anger and irritability. It can have an effect on any of the other organ systems, such as the spleen, which represents worry and anxiety. That in itself can affect the kidney, which happens to deal with fear and shock, our most basest emotions, and also the heart, which has excessive joy and excessive behavior. Finally, it can affect the lungs, where we talk about grief and sadness. Each of these emotions can affect a physiological system, which is also incorporated with these different organ systems. The liver in itself is the biological and mechanical. So let's take 2 of the organ systems that we're aware of in Western medicine and also in Eastern medicine, the heart and the liver. The heart in itself is easy to think of because we know it's involved with cardiovascular health, involving moving blood flow and circulation. In Chinese medicine, we essentially think of the heart as being the organ system that pumps the blood, helps get nutrients around the body, and during the daytime, it's involved with mental functioning and our thought process. When it comes down and gets a chance to rest at night, it helps out with our sleep process, so basically our sleep-wake cycle. It also reflects into the skin, which we see with hot flashes and sweating to help cool the body down, but also can be a hormonal response. The best way to help treat someone with heart issues is sometimes getting to exercise. So the idea of moving blood flow throughout the body helps both Western medicine and Eastern medicine. On the other side, we have the liver. And the liver can be looking at as the biochemical and mental emotional detoxifier of the body. It's kind of interesting to think that just as we take in medications and the liver needs to process them in order to make them active, or we need to process them in order to get them out of the body, we do the same things with emotion. The liver in Chinese medicine takes in different types of stimuli and decides how to respond to them. We would almost think of that as the way the brain functions as far as interpreting. But in Chinese medicine, the liver's in charge of that. It also stores blood and helps move qi, or the vital essence of the body, and can reflect into someone's eyes. So if you're looking to see what kind of emotional state in them, you can look directly in their eyes as another way of kind of guessing how the liver might be doing. Someone's ability to express themselves in multiple forms, whether it be in speech, in writing, in music, can help the liver kind of detox itself, essentially. So both of the heart and the liver become really strong organ systems that we watch in holistic medicine in order to help balance out emotions. Also in Chinese medicine, on an interesting note, is each of the 5 organ systems not only have emotions related to them, but also personality types. So when we're working with a patient, this may be giving us more information about how they experience the world. The liver type tends to be a planner. The heart type tends to be a passionate, excitable person. The spleen type tends to be a nurturer or caregiver. The water type, kidney type tends to be reliable, trustworthy, and dependable, making those key characteristics for how they want to see and experience the world. And the lung type tends to be the creative, easygoer, dreamer. While these aren't used for diagnosing and treating a patient, it does help us give a better mindset of what this person might be experiencing and how to best serve them. So we can't take the emotions out of someone's experience and their goals. We have to kind of create a plan that not only works with where they are in their own life now, but how they also interact with the rest of the world. When we use acupuncture as a therapy to help treat emotions, there are some specific points that we try to introduce to a patient. The first one can be pericardium 6, which is located on the inner side of the wrist. This particular point is also known as the motion sickness or seasickness point. It's because this is where those seasickness bands basically are put. And what they're doing is they're helping to basically take your mind off of what's currently going on, to help open up the chest and settle the stomach, and to kind of help on how nerves and the nervous system work to create emotional stress on other parts of the body. Liver 3 and Li4 are located on the hands and feet and basically are great points for not only reducing anxiety and stress, but they're also pain relieving points. As we see, chronic pain also has a condition or commonality with basically having increased emotional conditions as well too, especially depression. So if we can decrease pain at the same time as we're working on emotional issues, it's a great combination. Gallbladder 21 and gallbladder 20 are basically located at the base of the skull and also the tops of the shoulders where people tend to carry the most tension. These are very tight areas, so by releasing them with acupuncture points or even acupressure, we can kind of help to relax the upper part of the body as well too, which often allows for better movement into the head and increases circulation to the head and also to the muscles of the shoulders and the upper neck. And finally, auricular acupuncture can be beneficial because it's using another part of the body to treat other areas of the body. You can use auricular acupuncture to help settle stomach problems, to help decrease hypertension, but one of the main things is they have a point named Shen Men that actually helps as a reset button for emotional stress. You can also learn to use different types of points at home as well too, so patients can go home and learn to stimulate these points when they're not actually into the office. Acupuncture works as a great way to balance emotional health because you can have so many different points to choose from, but then you can also modify the treatment depending on what's going on that particular day and in a patient's overall healthcare goals. Now, even small things can make a big difference, especially when you're working on emotional health. We know that emotions can change very quickly, and how someone expresses them can also change quickly. So when we look at holistic medicine, we can use the smaller things to make big changes. So that can be just like using an acupuncture needle to make a change. But there's been more and more development, and we see this normally in nature that small things make huge impacts. Nanophysics and nanomedicine has basically become a bigger and bigger deal over the time, and that's the idea that things are smaller and smaller in nature can still be present, even though we can't technically measure them. We see this as one of the ways of explaining how homeopathy works. We're going to talk more about homeopathy in just a moment. We see this when pheromones are let off by men and women that attract each other. We don't physically see these chemical substances, but we know we're attracted to someone that smells good, or we know they're attracted because they're in a different state. We can also see this in nature, basically, as sharks often will be able to tell there's this one drop of blood in water from miles around, so they know exactly where to go and to hone in on. And also we see this with the honeybee. Typically when we see honeybees getting pollen. Basically they're either bringing it back to the hive to make a larger amount of honey, or they help pollinate trees around a very large area. So small things overall can make a big difference, and that doesn't make any difference whether it's in nature or you're seeing this in medicine itself. So let's explore this concept a little bit more in the homeopathic realm. Homeopathy takes into consideration the totality of symptoms that a person presents instead of just focusing on one single diagnosis. It's a type of energetic medicine not practiced by many, but you can now go into a Whole Foods and see acute remedies on the shelf. When you look at homeopathy and what it really is doing is it's trying to figure out how that person is unique. What makes this person respond the way that they do? And that helps you determine what types of remedies might be best for them. This idea of like cures like kind of helps to basically make the person think, if I have a remedy that makes someone hot and irritable, it might be good for a hot and irritable type of personality or a person that has issues with that. So when we think about homeopathy, what we want to do is think about why are they uniquely in the situation and reacting the way that they are. Homeopathy can be used like you see it acutely, like you see it on the shelves at your local health food store, where it has one indication listed. Each one of those remedies goes into a much, much deeper realm of what they represent. And we're going to give you an example of that in just a second. But it's a nice, gentle balance between trying to change up a person's issues that they're having problems with without feeling like you have to suppress them or replace it the way you would with the medication. So let's talk about a typical type of homeopathic remedy that's used in an acute case, but then also has some constitutional and long-term remedies. Many of us might be familiar with some types of homeopathic remedies, such as arnica for trauma, pulsatilla and agnasia for grief, and even carbovegetalis and nox vomica for digestive issues and nausea. But one of the most important things when you're taking a constitutional remedy is to match the right remedy with the person as they prescribe and they describe themselves to you. Like I said, we're trying to figure out what makes them unique in order to create a remedy for them. So Apis honeybee is very interesting because in an acute sense, it's kind of like being swollen and stung by a bee. You have pain, there's swelling and redness and inflammation. You don't want to touch it. You may even shriek out because of the sudden onset of being stung by a honeybee. And the bee itself likes to be with others. It has a matriarchal system, and it likes to go after what it wants to. It likes the nectar. So a person that comes in who may want or may be a Apis remedy may have some of these same emotions and sensations. They may feel red and inflamed. They may be swollen. They don't want to be touched. They may be worse from heat. They may have an intensity and excitability, like pent-up emotions, and even sexual tendencies, because they want their goal, they want their honey or their nectar. They're kind of always busy. So some of these different types of conditions and characteristics can be used in a homeopathic case to help come up with the best remedy for the person. That way you're not stuck with just simply prescribing the same remedies over and over again for someone who has anxiety, depression, fears. You want to be able to come up with an individual remedy that works just for them. So when you sit down and do a homeopathic in-case, you're really diving deeper into what makes a person uniquely them. Another therapy we can look at when we want to do some emotional healing with the patient is looking at their diet, their nutrition, and even sometimes use the botanical medicine or supplementation. And when we look at their current diet, it's very interesting to see what foods they gravitate towards. Are there certain cravings for sweet foods, for abnormal foods such as pica when people crave chalk, say during pregnancies or in inedible objects? Do they have a desire for even their own home cooking that they grew up with? Is there a sentiment that's attached to that? So we always have people do a current diet diary because we want to see what they're eating and what they might be lacking. We need to create a complete nutritional homeostasis in order to optimize the physical health and also the mental emotional health. Sometimes we gravitate towards certain foods because we're trying to get something out of them. A chocolate craving may actually be a magnesium craving. We also want to look at their endocrine support, so that may be looking at hormonal panels or looking at their neurological system to see what levels of serotonin or dopamine may be being produced. Remember, serotonin and dopamine and a lot of other neurotransmitters are actually produced also in the digestive tract. And so looking at different types of good bacteria and bad bacteria that are in the digestive tract and the foods we feed them can have a lot to do on our mental emotional state. Our hormones can fluctuate throughout the day and throughout the month, and then it also might play into the different types of emotions we end up feeling. We need to also look at, is diet and nutrition having anything to do with constant inflammation and pain or swelling? And this is really important with chronic pain issues because we may be ingesting foods that are creating more of an issue and not allowing certain supplements or medications to even work properly. We also want to see if there's any kind of common nutritional deficiencies that may be related to different types of medications. And these types of medications not only have to deal with treating the rest of the body, like statin drugs or hypertensives, but some of the benzodiazepines, antidepressants, anti-seizure medications can also deplete some of the nutrients that are listed here in this. And then botanical medicine wise, we want to look at whether or not we need to supplement for a short-term effect with herbs like adaptogens that help the adrenals to function better. They help turn on cortisol when we need it and help to slow it down when we have too much of it. Nervines that help to calm the nervous system and create more balance, or something like flower essences or essential oils or Bach flower remedies that may be even used for someone who's very sensitive and just needs to have some of the essence of those particular herbs. This whole diet, nutrition, and botanical medicine combination needs to be done by working with a professional, and it also can work well when you're trying to do different structural things as well as working on mental emotional issues. We also want to make sure that the body can move properly. When we get outside in the fresh air and we move around instead of sitting in one place, we not only affect our nervous system, but we affect our cardiovascular system, our respiratory system, our musculoskeletal system, and all those get blood pumping through and allow nutrients and the immune system to function properly. So when we think about this in chiropractic care, we're aligning the body so that way the nervous system can function properly. We can get the nerves to basically allow for normal organ functions as well too. We can also do this through exercise, and whether that exercise is a brisk run in the park or doing Tai Chi or Qigong, those types of situations and those types of exercises might be different for different people. Someone who's really stressed and on the run all the time may actually benefit from a slower pace type of situation like a Qigong or a yoga to kind of help calm their system down. For people who can't move around that well, they might even have to do laps in a pool or just swim in the pool to help take weight off of painful joints and swellings. Even some things such as massage and lymphatic treatments can help move lymph and muscle tissues to help with relaxation. Just because it's a massage doesn't mean it's not therapeutic. We can certainly find plenty of trigger points that have been built up because of different types of stressors and help to release them. So movement is always part of treating emotional issues, and we can do it in many different forms depending on how a patient presents. When we use holistic medicine, such as chiropractic, nutrition, acupuncture, botanical medicine, homeopathy, exercise, we have to still put these into perspective. We're not always there with the person. The practitioner is there as a guidance to help someone work through things. So making planning steps to help preserve emotions is important. We have to think about some of the downtime that we have in our lives. Do we have enough downtime? Do we have enough time to just relax? And we have to stop thinking about it as a waste of time, that we should always be doing stuff. Sometimes in order to be the most productive, we have to take a break. So we need to look at how are we actually using our time creatively. There needs to be some kind of consistency in our lives. If we're always skipping meals or we get up at different times during the day, that can throw off not only our physical health, but also our mental health as well too. We tend not to have as many plans and goals that we need to get done during the day, or we tend to put them off. We have to learn how to think outside ourselves. And this is often what you see when people start getting involved with different type of charity works, or they adopt a pet, or they get involved with other different social interactions. Because what they're starting to do is kind of come up with a bigger plan that's bigger than themselves. And overall, what you want to try to do is try to find something that you actually respond to, that you get excited about, because then you're willing to give up your time, and it means much more to you to create a positive impact. By creating a plan and solution with specific goals, we're able to move forward instead of staying still and being stagnant. We need to surround ourselves in a place of positivity, but also a place of what's going on socially and being aware of all the different things around us. So not only does that keep us safe, but it also keeps us aware of new events and new possibilities. We do have to find a place that we can use as a healing environment or healing space. And a lot of times architects and different people who are planning different types of buildings, such as healing spaces and hospitals, are taking this into consideration as they even think about how they structure their room. When we think about a healing environment, does our house and where we spend most of our time in, does that tend to reflect our personality? Is it cluttered or unorganized? By looking at how we feel when we go into the doctor's office, do we feel like it's too medical, or we do feel uncommonly out of norm with it? When it comes to treating any issue in medicine, you have to make sure we treat the Triad of Health. So in review, we have to make sure we treat the biochemical, the structural, and the mental emotional aspects of all health issues. By doing that, we can kind of create perfect true harmony in health. And by examining each one of these issues and some of the treatments that we have to offer in there, we can come up with the best treatment plan that's specific for the person in front of us. Using different types of balancing methods, movement correctivity, and a physical alignment, and making changes in someone's diet are easy things to say, but they're difficult to carry out in the long run. Just as emotions can fluctuations and change, we basically have to change up our treatment plan for patients as well too. We have to not only come up with long-term goals, but short-term goals, and understand that the person in front of us is a person in front of us. So if they're coming in on some type of medication or they have a physical ailment, we have to be able to treat that physical ailment and treat them where they are in their medication cycle. Overall, when we think about emotional health, we know that it's not one that's easy to talk about. So we spend a lot of time with our patients discussing how they feel, what kind of response they have to a reaction or a treatment, and then basically trying to figure out how do we create the best healing environment for them at that moment. In conclusion, emotional healing has to take place over a large period of time, and it's not something that's easy to discuss with practitioners or between patients as well too. Often we can't find the right words to express how we feel or even the right treatments that get us to go forward in our progress. But some of the main things we want to do is make sure that patients feel like they have that safetyness around them no matter what time it is. They feel safe in their community, they feel safe within themselves, they feel safe within their homes. That can kind of help bring about calmness. And if we can be calm, we can make rational decisions and try to think things through, sometimes taking our mind outside of the box, thinking outside the box, and also trying to look at different avenues and different options. We want to be able to support patients and find support networks for them. So essentially, know that they're not alone and they are in it together with other people, but to make sure that support system is exactly what they need and that they have it when they need it. Also making sure that patients are self-sufficient. Practitioners are there almost like when you go to school as a kid. You're there to help learn the lessons, but you have to drive home what you're trying to learn through the homework. And so by being self-sufficient, you know that you can survive in the environment surrounding you no matter what happens. And we have to make sure that patients also stay socially connected. Even if they feel that they're alone and they don't have family that's nearby, that social connection can kind of help them get back into the community and become an active part of society. And to always remind patients that there's always hope. I want to thank you for watching this webinar on how emotions affect our overall health. Hopefully you were able to learn something through this webinar that you'll be able to apply into your own health and actually take this information away to possibly help others. During this trying time, I know it can be very difficult to see outside and remember what the normal is, but just remember your emotions do have a way to be positive and negative. Don't allow those negative emotions to always take over and create other issues in your health as well. Hopefully some of the advice that we've had here and some of the therapies like acupuncture, dietary changes, exercise, homeopathy will give you a chance to understand that there's other options that are available for you. And feel free to use the contact information listed on this slide, which is the direct number to the office, 703-698-7117, or my direct email, s.pina@rosellecare.com, which is a HIPAA secure email, to reach out to me with any questions you might have. While this lecture is usually given in-house, we know that because of the current situation, we're not able to do that. So some of the questions that you may have related to emotional issues and care and possibly some suggestions may not be appropriate if you're just calling the front office. So feel free to reach out to me directly. As always, we want to offer this evaluation not only for acupuncture, but homeopathic as well too, to make sure that we can have you come into the office and sit down with myself and review how either acupuncture or anything else that we discussed here during this lecture might be able to help you. Our team is really here to work as a team for you with everything else that you're currently experiencing. And then even if that means setting aside a time at a later date to come in, we can certainly work that out. But you need to give us a call, and we're looking forward to helping you with any questions you might have. We work with Caring for Others, which is a 501c3 organization, to help donate our money to them and our time to you to kind of help others while we're helping healing. I want to thank you again for watching this webinar on how emotions can affect your body and health. As a gift to you, we want to offer you this special to come into the office and sit down with myself to go over your healthcare goals and needs. Whether it's related to emotions or another concern, we can sit down and come up with holistic solutions that you might not have thought of before. Instead of paying the normal price of $225 as an initial consultation or a returning patient, this particular offer offers the new patient consultation for $99, which is a tax-deductible donation that goes for caring for others, which is a 501c3. We've been working for a while with this particular charity, which also helps to provide not only health care to those who can't afford it, but also helps to educate the public on natural solutions for chronic and chronic conditions, and also provides scholarships for those looking to go into the fields of chiropractic, nutrition, acupuncture, and naturopathic medicine. It's a great way to come into the office and have a chance to sit one-on-one with any of the doctors, but myself included. And also we'd be able to go over if any of the ideas that we've discussed during this lecture are appropriate for you. So feel free to give the office a call, again at the number at 703-698-7117, or you can email us directly, or you can email me directly at s.pina@rosellecare.com. We'd happy to find you a spot at the office, whether that be now or in a few more weeks when you feel comfortable in coming in. Again, please feel free to email any questions that you may have, and thank you and I hope you enjoyed this lecture.